I'm Nancy Lindell, Public Relations at Mission Health. I'm here today with Dr. William Hathaway, Chief Medical Officer for Mission Health, to talk about COVID-19.
Good afternoon. Thanks, Nancy.
Thank you. So there's been a lot going on this week. It's been a big week in Asheville and other places around the country. People are talking about still the virus and social distancing in regards to recent events. What can you tell people to help keep people safe?
Yeah, I think the first thing that I'd like to say is it's a tough time for us all. In the midst of a pandemic, we find ourselves facing some of the biggest challenges related to civil unrest, race relations, and a host of issues which I think everyone is familiar with. And I just want to express my heartfelt thoughts and empathy toward the community at this difficult time that we're going through. And I'm hopeful that through calm, thoughtful presence and leadership that we can work our way through this and come out on a much better place than we are right now. As it pertains specifically to the COVID issue, which we're talking about today, we're obviously referencing the mass gatherings and the protests that are ongoing in many communities throughout the country, ours included. And we've received lots of questions and concerns about whether or not we think this will have a negative impact on our COVID crisis in Asheville. And we know that there's increasing prevalence. We've seen a rise in the number of cases in our community over the past few weeks. There's a real increase as we open up the economy. We've expected that, and we're seeing it. So we just caution people, be careful no matter where you are. Wear a mask, try to maintain social distancing, and realize that we're seeing an increase in cases in the community.
And where are we with cases as of this morning?
Well, at Mission, I don't have the exact number at this moment, but I believe it was about 18 in the hospital. We've been hovering, as I've said earlier this week, in the 15 to 20 range. We have 3 or 4 patients on ventilators at this point in time, and we've seen an increasing number of cases test positive in the ambulatory setting also. Still not at a situation, it's certainly more than we want 0, but it's certainly not at a crisis level that the system, both ours and others in the community, Advent and Party in particular, who we communicate with on a regular basis, we still have ample capacity to care for these patients.
And we've talked about before wearing a mask. We wear masks for other people. We talked about that last week. We wear masks as a respect for other people. Does the mask protect you, or really does it just protect other people?
Well, so first and foremost, it protects other people. Any form of a barrier. Remember, this is droplet spread, so secretions from our bodies get into the atmosphere or get onto surfaces and people come into contact with them. So the fewer secretions that we spread, the less likely that there'll be transmission. And as we've learned over the course of the illness, there are a number of many people, before they become symptomatic, they're in a viral shedding period. And so wearing that mask, you may feel well, you may think you're fine, but wearing the mask prevents that spread to other people, and it says to them that you care about them because you don't want them to get the illness. So it's a sign of respect. I want to emphasize that. But we also know that it does serve as a barrier for yourself too, and so you can protect yourself from getting the virus from someone else by wearing a mask. The best situation is where we all wear masks, and that way we have double protection for ourselves and for others.
So that would be the advice to our communities right now across the country, is that we need to, in the absence of practicing the social distance that we've been talking about, at least wear a mask, keep your hands away from your face, wash your hands.
Absolutely. I would reiterate that 1,000 times if I could. We're still trying to keep the curve flat. The best way that we as individuals in the community can do that is by adhering to those 3 W's. Wear a mask, wait 6 feet apart, wash your hands, and keep them away from your mouth and your face. And frankly, it's disheartening for me to see the lack of mask wearing when I'm out in the community in public places. I know that people don't like the comfort or the discomfort of wearing the mask. I know that there's a sense of, for some younger people in particular, of invulnerability that they are invincible and that they can, that, who cares if they get sick? It's true, it's a mild illness for most people, but failure to wear a mask continues to allow the virus to be spread to those who are vulnerable, and those are the ones we're most concerned about.
If you don't have a mask and you can't find one to buy anywhere, what should you do?
Well, I think that's a really good question. It's important to know that any kind of a barrier is better than nothing. And while lots of studies have been done looking at, this mask versus that mask, cloth, different types of cloth, I would be less caught up in that than I would be just trying to find something to protect my face. So if you're a seamstress or you can sew, there are lots of patterns online that you could get the material and do it yourself. That seems to be a dying skill these days. Not enough grandmothers around to help us out with that one. But there are simple ways to make a mask, and actually the CDC, the Center for Disease Control, has on their website simple ways to make masks using cloth, cutting out cloth, and using ties, simple homemade fashion ties that are actually easy to do.
And I've read too with the homemade masks and the material that if you insert a coffee filter in there, that will be helpful. Is that?
Yeah, I mean, it can't hurt. Any added layer of impermeability will increase or decrease the likelihood that you're either going to transmit the virus or have the virus transmitted to you.
Okay, so and along the lines of helping others, what have we learned recently about the ability for plasma to help persons who have COVID, and who can donate that?
Yeah, so the plasma question is really interesting, and I think I'll take a couple steps back so that we can understand how or what the concept of plasma is about. But it's really a long-standing old technique that we've used to fight infections. It dates back well over 100 years. We used it initially in looking at children who had diphtheria, which is a respiratory tract infection also. At the time, around the turn of the century in the early 1900s, 50 to 100,000 people were dying yearly from this illness, young children. And they speculated that if they took serum or plasma, either from animals or from people who had been infected with diphtheria, and then gave that plasma to those people, that they would be resistant. And they were. They didn't understand why back then, but what we're actually doing is transmitting antibodies, those proteins in our body that fight infection, from a person who's already fought off the infection to someone who's suffering or about to get the infection. And so we're using that same principle, over 120 years later with COVID-19. We'll take patients who've recovered from this SARS-CoV-2 virus. We will, just like you donate blood, we can take your blood out, separate the plasma, and then use the plasma as a transfusion for someone who's suffering from the illness. And what we're doing is we're giving them those valuable proteins that go in, and those proteins bind to the virus and neutralize the virus. And when they neutralize the virus, it can't infect the cells and it doesn't cause the disease. So it's a very short duration of therapy. It doesn't provide long-term immunity, but it does provide immediate benefit for people who are suffering from the illness. In order to be able to donate plasma, you have to have been infected. And so we're looking for people who have recovered from the illness to reach out to the local blood banks to offer their blood and their plasma for this service.
And if I feel I have symptoms and I want to get tested, how would I go about doing that?
A couple different ways that you can do that. The Buncombe County website here in Western North Carolina has a patient symptom tracker. It walks you through a series of steps and then basically determines whether they think you should be tested or not and refers you to a testing center. There's a number of urgent cares in the community that are doing that, Mission Health included at our MyCare Now urgent care on Long Shoals Road. If you have signs or symptoms, you're always welcome to walk in there. We also have a symptom tracker, and so there's lots of ways through our virtual platform at Mission Health website, the virtual clinic, that people can get screened and they get referred for testing.
And what if feel like I have symptoms of something else? It's not COVID. Maybe I have a pink eye or a urinary tract infection, I think, but I'm afraid to come in because I don't want to get sick with COVID. What should I do?
I think the first thing is to call your primary care provider and discuss it with them, or you could do a virtual visit through our virtual clinic and get the symptoms checked. And oftentimes that mitigates or eliminates the need to have a visit done. Or if there are still concerns based on that virtual visit, then they'll refer you to wherever you need to go to get the help you need. And I want to reiterate, we've said this before, we'll say it again, that while there's no such thing as a 100% safe place, now, given the prevalence of COVID in our community, we do believe our healthcare facilities and our hospitals are safe places to get the care that people need.
And what if I'm due for a mammogram or something like that? Should I put that off for a little while until this sort of clears up, or should I come in and get that done?
At this point in time, we're encouraging people to get their routine health care done. We think that delaying care is, given the prevalence, relatively low prevalence, although it's increasing in our community of COVID-19, we think that the value of preventive care, especially if it's a mammogram or a colonoscopy or care for your diabetes or heart failure, lung disease, whatever the case may be, that's important. It's really important that we get the kids in for their vaccines. The vaccines, they're on a regularly scheduled pattern, and we don't want children to get off that schedule any more than they have to, because then they're susceptible to a host of other infectious diseases.
And speaking of vaccines, is there any progress being made on a COVID vaccine?
Continue to make progress. There are a number of vaccines in the pipeline. Some use the traditional platform of either injecting dead or attenuated form, a weakened strain of a virus into the body. Those are being looked at. And then some novel technologies looking either at what we call viral vectors or mRNA, messenger RNA, which helps our body to produce the proteins that then we recognize as being foreign and that the body fights off by developing those antibodies. I don't think that we can hope to see those anytime very soon. The process by which we develop the vaccines takes time. It takes time to do the initial testing. It takes time to make sure they're safe. We have 3 different phases in the testing process, and we're just in phase 1 and entering phase 2 of some of these trials. And then the phase 3 of the trials involves widespread testing of, tens, hundreds of thousands of people. And so I think the very earliest we could hope to see anything is in a phase 3 trial would be towards the end of the year. And then we have to wait for safety data. So it's going to take some time. It is truly something we look forward to as a potential major solution to this problem, but it's not an immediate solution by any stretch of the imagination.
So, in wrapping this up for our community again, our immediate solutions to this problem are what? What should we be doing?
Yeah, same things we say every time. It's wear a mask, wait 6 feet apart, wash your hands, limit your interactions with other people as much as you can. We recognize that we have to find the new normal, but we can do that thoughtfully and carefully so that we don't see a sudden spike in cases.
Thank you, Dr. Hathaway, for your time and expertise today. We'll be back next week with more information on COVID-19.